Welcome to this session on quality improvement education in practice. My name is Fiona Moss. I'm one of the members of the Strategic Advisory Board, and my sort of daytime interests are education and quality improvement. So in that order, I think quality improvement is essentially about education. So it's a great privilege to chair this session. I'm not sure how many of you are Twitterers. But the hashtag for this meeting is hashtag quality4. I hope we're going to be joined soon by two information DJs who should be able to pick up any questions that you have. So just tweet your questions, and I hope we'll be able to pick them up and put them to our four presenters at the end. I've been quite strict with the four presenters. I've asked them to present for 10 minutes so that we can have a good 20 minutes discussion at the end. And we'll hold, if you can, hold questions until the end. And I'm going to ask the four of them to come up, and then I would like to get a discussion between you and the participants. So I hope that's okay, and I just hope our information DJs come, because it'd be really good to get some of your tweeted questions to get the discussion off to a start. So it's a great pleasure that we start with Jessica Perlo, who's going to talk about integrating interprofessional teams into quality improvement education. Jessica.
Thank you. Can you guys hear me okay? All right. Well, thank you so much for coming today. As Fiona said, I'm Jessica Perlo. I'm here from the IHI Open School. I'm going to talk to you a little bit about how we engage students across health professions in the work that we do. So stepping back for a second, the reason that a lot of us are in the room right now is because the need for IPE, interprofessional education, has been well established, along with influential reports from the Lancet Commission, the Institute of Medicine, the World Health Organization, linking IPE to improved health outcomes. There's also a business model for this now, where the public is starting to demand it, and that it's showing that it increases employee retention and reduces turnover. There's also expectations of students now that they're able to leverage one another, that they can assert the values of diversity and inclusion, that they can communicate in support of a team-based approach to delivering patient-centered care. And students want this. This is a survey last year of about 336 different health professional students, so medicine, nursing, public health. And when asked about the importance of IPE, 97% ranked it important. We didn't invite that 3% there here today. They weren't allowed. But the reality is that this is still uncommon, that courses remain short and variable in nature. And the reasons for this are many, and here are just a few of the barriers to IPE, and you know this better than I do, so I'm not going to go through it with you, but this is just some of them. And they're good reasons, and they're tough barriers. But the good news is that we believe that students can do this work themselves. In fact, we're going to show you a couple of examples of how they're doing this. I'm going to tell you about the Open School. So for those of you who don't know, we exist to improve the patient safety competencies in the next generation of healthcare professionals worldwide. What we're trying to do is change the way health professional students are trained, so they're not just learning about delivering care, but they're actually improving it. We do this through our online courses. We have 19 courses in quality improvement, patient safety, leadership, management of healthcare operations, patient and family-centered care. They're absolutely free to students and faculty, and they can get a certificate that they can show to employers for completing the courses. We also have an app so that they can take the courses on the go. In addition to our curricula, we also have a chapter network of over 570 chapters worldwide, making up about 130,000 health professional students in 57 different countries. And they're doing all sorts of activities. Here are a few pictures of some of them, and I'm going to give you a couple of examples. But they're taking the courses together, they're holding events, they're doing quality improvement projects, and most of them are interprofessional in nature. You can see here the breakdown of our chapters, and it's not just health professional students. You also have law, business, and engineering in here as well. And it is the coming together of the curricula and this community that we think creates a vibrant environment for interprofessional education. And we do this through the IHI Open School Quality Improvement Practicum. We've seen projects come in on improving wait times in operating theaters, surgical checklists, hand washing, and medical reconciliation. It looks just like our other courses, except we have a prerequisite. They have to have a foundation of learning, quality improvement 101 through 103, to give them the fundamentals. Then they identify a faculty locally to help them lead this work. They identify a health system sponsor and an interprofessional team to help them do this, and a project. We ask them to submit forms to us, and this is what makes it different from our other courses. They have to submit a charter to us, showing us what they're trying to improve, at which point we give them feedback. We ask them to do a cause and effect diagram, 2 iterative tests of change, a run chart, and a summary document where, again, we give them feedback. Once they've completed the project, we give them the Open School Practicum Certificate of Completion. So I'm going to give you 2 quick examples. The first comes from the University of Dundee. Here, students created a student-selected component, an elective. It was initiated by medical students in the chapter who reached out to nursing students, and together they created an elective by taking the courses and running a workshop, and then putting projects and opportunities for future students to get involved in this work on the web. And they received, for their work this past month actually, the first annual Kevin Murphy Prize for Patient Safety. Kevin Murphy's mother, Margaret Murphy, is also the WHO's external lead for the Patient for Patient Safety program. And she says that these 7 students who've started this elective have been able to change the culture and enhance the clinical practice of interprofessionalism at Dundee. Georgetown University in the States is an interprofessional chapter of over 70 members, and you can see here not just medicine or public health or nursing, but also business, and they reached out to the hospital as well. That's one of the reasons they were so successful. They engaged in projects that were central to the strategic plan of their institution, and these are just some of the projects you can see here that they worked on. They gave roles to each of the health professional students that were on the project team, very defined roles. They had barriers that we all have, time and maintaining momentum, but they were able to reduce central line infection rates from 3.2 per 1,000 days to 0 for over a year now. So what makes this successful? We think it's because it's free, first of all. Students don't have a ton of money. It's student initiated. They have ownership of their work. They can see that they're contributing to the solving of health problems. And many leverage interprofessional relationships at the faculty level that helps them to connect with other learners. Faculty tend to be involved with their chapters, so it's easier to connect. The practicum provides a meaningful clinical experience. It's something that they can manage on their own, but they can also see that they're having that effect. And they agree on a unifying philosophy. This commitment to the common goal of collaboration, we think, is what makes it successful. But we have challenges as well. Protected time for teaching activities still remains a challenge. This is for both students and faculty. Again, part of this might be because of this promotional pathway and reward structure, the fact that it's not part of the culture yet. It's still hard to find still hard to have access to faculty trained in delivering IPE, point of care experiential learning, and quality and safety. There's also sometimes a lack of institutional support for these activities where maybe there's some room to do didactic work, but certainly not experiential learning or project work. And sometimes there's a lack of resources needed to facilitate the use of students on quality improvement and patient safety efforts. So that's all, and I think we're going to wait on questions actually, so I'll hand it over. Thank you.
Great, just thanks very much. I like the bit about it being free being one of the things that makes students take it up. But 'twas ever thus.